All right, good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also chiropractic physician at Gates Brain Health. And today we're talking about depression and hormones, the next sequence in our series on depression. Again, we're talking about depression at length because there's this entity referred to as treatment-resistant depression, where individuals take antidepressants and they don't feel better. That accounts for, depending on who you read or what research article you're looking at, can be between 40 and 50% of people with major depressive disorder. As I've said in other broadcasts, this type of depression is different than the depression term that we throw around in our society. You know, people will say, okay, I'm depressed because of this going on, where they're depressed for a few days. And certainly they are experiencing what we call dysphoria, a sad mood. Depression, when we're using that term clinically, really refers to somebody having this at least 2 weeks and can be upwards of, many months, sometimes years. Can have a relapsing and remitting course. And so it's important to understand the neurobiology and physiology of depression for those who are suffering, because if you're trying medications and they're not working, or you're going to psychotherapy and you don't feel it's helping, these other correlates, as we term them, can be important. The other ones we've talked about thus far have been associations with the thyroid and Hashimoto's. I talked about gluten earlier this week. We've talked about the microbiome and obesity, and now we're talking about hormones. Because all these factors, I'm going to grab my brain model, all these factors dramatically influence our brain and our neurochemistry in the brain. The brain is basically a very metabolically active organ. 2% of our body weight consumes about 20% of the oxygen coming into the body. So a lot is going on in this region of our anatomy, and so those factors we need to pay attention to, and today we're talking about hormones. Now, I scoured the literature last night, and interestingly, there's not a ton of great literature examining this topic, and in fact, you could tell there's a sentiment within some of the mainstream healthcare journals about using hormones for something like depression. The use of hormones is more of a new phenomena. Certainly the use of hormones for women has been done for a long period of time relative to menopausal and postmenopausal symptoms. But relative to guys, I would say it's a relatively new phenomenon. Now the term low T, referring to low testosterone, is commonplace in our world, and you see more and more male enhancement, male health clinics popping up around the country, where middle to later age guys are going in to get their testosterone injections or their testosterone gels. And so it's becoming a thing, so to speak. And it's not necessarily a bad thing, but it's a thing. And lots of times when a thing hits the marketplace, it may take the established system a little while to adapt. So this was the best article I found on the subject. It's pretty current, 2019 JAMA Psychiatry. So JAMA stands for Journal of the American Medical Association. And so this is the psychiatric journal within JAMA. So it's a big journal. And here they were looking at, they did a meta-analysis basically. And let me see here. So they looked at 27 randomized placebo-controlled clinical trials involving 1,890 men. So that's a pretty good sample size. And they found that testosterone treatment was associated with significant reduction of depressive symptoms, particularly in participants who received higher dosage regimens. And so that's another thing. And it's interesting because hormones have been commonly used in athletics and the bodybuilding world and the strength sports for a long period of time, so they have a stigma associated with them. And I think that's part of what I've seen, the mainstream system be a little reticent to go down this path of using something like testosterone therapy for men who are otherwise considered normal. And, they have to control for concerns of, well, boosting someone's testosterone or a male's testosterone, will this affect their heart negatively? Will it affect their blood viscosity? Will it affect their lipid panel and result in more heart attacks? So doctors have to be aware of all those side effects. But the point is that as we age, things start to decline, including our hormones. And so I think this is very interesting because there is such a stigma lots of times about, going to a mental health professional or going and receiving a medication for something like depression. There shouldn't be, but there oftentimes is, because I hear it a lot with my patients. This is an interesting facet that maybe not everybody is aware of, that hormones can significantly impact something like depression. And I've seen patients who've had depression who are males who, I've referred them for a testosterone treatment and they've done rather well. So I think this is really good. This is fairly confirmatory of what I've seen in clinical practice. And here, one of the top journals coming out and saying basically 27 randomized controlled placebo-controlled clinical trials, showing definitively that testosterone therapy does work for helping depressive symptoms, as you can see here, effective and efficacious in reducing depressive symptoms in men, particularly when higher dosage regimens were applied. And this is something to talk to your doctor about. So in my experience, again, a lot of doctors may be reticent to go with higher dosages, but this is something to talk to doctors about. There's also age management doctors out there. You can look up A4M doctors. It stands, so A, the letter A, the number 4, and then M. It's called Aging for Management. And these are typically MDs and DOs that have split off from mainstream, and they're usually doing, bioidentical hormones, and they may be doing age management. And these doctors work with these types of situations a lot. So if you're coming up against roadblocks, that may be the type of doctor to consult. I'm not encouraging that. I'm not referring you for that. I'm just saying, trying to get information out there of what I've observed in clinical practice. So again, JAMA Psychiatry. This is the best journal I could find on this topic. And how does testosterone enhance things? I mean, testosterone is a steroid. We have a lot of steroids in our body. Basically, most hormones have some sort of steroidal effect where they're affecting DNA replication, things like that. Well, hormones make our brain healthy. Think when we're young, lots of times we're very youthful, we have a lot of energy, and as we age, we go through a lot of stressors and we have a lot of demands in our lives, and then as we age, our physiology tends to wind down. Our gonads, so to speak, whether they're testicles or ovaries, tend to produce less of those hormones. If a woman gets to that point where she's around 45 to 52-ish, then she may go into menopause, where now she's not making enough estrogen to have a cycle. But that same process of hormonal weaning, and they call it hypogonadism in men, which some people think is a funny term, but I mean, that's the term. It means hypo meaning low gonadal function. So hypogonadism happens in men as they age frequently, and their testosterone goes down. They don't feel as youthful. They don't feel as strong. They don't have the muscle mass that they once had, the vigor, and it can be associated with some depressive symptoms. So if you know a guy who has depression, who's maybe not responding to mainstream treatments, this may be something for them to bring up with their doctor and having their testosterone checked. I will say from a functional perspective, why a lot of men have low testosterone is either due to chronic stress, because when we're under chronic stress, which can be associated with the depression cycle, which I'm going to talk about soon, I've talked about a lot in the past, where when we're depressed, our stress area of our brain, our amygdala, gets hyperactivated. And in doing so, it tends to signal to the front part of the brain, which then sends signals down to the adrenal glands, which then produce cortisol, which comes back up to the brain to literally damage areas of the prefrontal cortex and then the memory area. So that is the physiology of depression. But in that physiology, particularly for men who have post-traumatic stress, their luteinizing hormone can go down significantly, where their brain hormonally stops talking to the gonads as well, because the brain is taking its reserves and putting it into the stress pathway, not as much into the testosterone pathway, simply. Also, as men tend to, we have this issue in our society where 2/3 of the population is either overweight or obese. And as men, put on this body mass, more adiposity, more fat tissue, they're going to have a tendency to convert their natural testosterone into estrogen. That's called aromatization. Also something to be aware of, because then as a man has more estrogen, then he's going to have less testosterone, and these hormonal ratios become more, basically it becomes closer, so to speak. So the ratio changes, and that could be bad in essence for a man's overall physiological health. One thing that I liked here is that depressive disorders such as major depressive disorder and dysthymic disorder are psychiatric illnesses with devastating personal and social consequences, owing to a persistent depressed mood, negative thoughts, and fatigue. The World Health Organization has declared depression to be the leading cause of disability worldwide. So again, this is from that JAMA article that I've been mentioning, JAMA Psychiatry 2019. That is a powerful, powerful couple sentences, and there's one more here. So basically, they say the World Health Organization has declared depression to be the leading cause of disability worldwide. So often we think of people who are depressed as, oh, you're depressed, or there may be, the thought that, well, what's wrong with you? Your life is good, or are you weak? Are you stressed? What's the matter? Because lots of times the person looks normal. And I deal with a lot of conditions where people look normal, but they're not normal. They don't have normal physiology. And so this individual looks normal, but it's a huge disability. It's a very painful condition. It's an extremely serious condition. So I think that's important for us to realize there. It's the leading cause of disability worldwide. Current pharmacological treatment options show limited effectiveness in countering the disease. Current pharmacological treatment options show limited effectiveness in countering the disease. This is from a psychiatric journal. And approximately 30% of patients do not experience sustained symptomatic remission despite multiple treatment attempts. So as I said, it depends on who you read. They're saying 30%. I've seen estimates as high as 50% for treatment-resistant depression. So basically, depressive disorders are more prevalent in women. More than 1 million men are currently affected, constituting approximately 1/3 of all patients with depression. So, this is really important stuff. And if anybody wants to read this article, go find it on PubMed. It's a great article. And this is just kind of discussing the same thing. I won't read the whole article to you. I cannot stand it when people do PowerPoint presentations and do that. But I just tried to relay the more important vignettes, so to speak, of what's going on. In terms of hormones for women and depression, when I searched PubMed for the best matches, so to speak, a lot of the articles weren't that fantastic. In terms of most recent articles, this one came out, I think it's fairly new. I think it's around 2019. I'd have to go back and look. But here they're saying HRT, hormone replacement therapy, should be considered. This is an International Journal of Obstetrics and Gynecology, so an OBGYN journal. Hormone replacement therapy should be considered as a first-line therapy for perimenopausal depression, for estrogens are the first line of treatment for perimenopausal women. So here they're saying hormones need to be looked at for depression. So again, relative to depression, we all think that it's a chemical problem, or we've all been indoctrinated to think it's a chemical problem, and you don't have enough serotonin, dopamine, or norepinephrine floating between this brain cell and this brain cell. If you just had more, this chemical problem would be corrected. We now know, because antidepressants take weeks to work, lots of times, if not more than a month, that in actuality, medications typically grow new brain cells in the memory area of the brain, which opposes the fear center, which shuts down that stress pathway I was talking about earlier. And here they're talking about hormones. As our hormones decline, our brain is not going to do as well. And that's why there's a lot of topics, or a lot of discussion about, postmenopausal women using estrogen for brain health and memory and preventing Alzheimer's. So hormones, there's a time and a place for it. And so this is important for us to all understand. And let me go back to the live version. And good morning to everybody who's joining. And let me see if I have any comments. Thank you all for being here. Okay, great question. The brain damage I speak of, can this be reversed, or is it permanent damage? In essence, it is reversible, and that's what they've shown with antidepressants and other natural treatments that we utilize here at Gates Brain Health, because we focus on the natural side of things, the hippocampus, your memory area that should grow 700 new brain cells a day, can actually grow back. So this atrophy that happens from really high levels of cortisol in the prefrontal cortex as well as in the memory area, which is way deep in the temporal lobes, that can change with correct treatments. Most typically, it's looked at relative to antidepressants or supplements that are affecting neurotransmitters. That's a great question. Maybe I can go look at that and find any volumetric changes with hormones. I wouldn't be surprised if there were, just because what do hormones do? They help DNA replication. They help protein synthesis. When we have protein synthesis, then we're going to have better physiological function. So that is a great question. And yeah, so I think that pretty well covers it. Any other questions, send them to me. I hope you all have a lovely Saturday, and I'll be back on Wednesday with another topic on depression. I think we're getting close to genetics. It may be on MTHFR, it may be on something else, but yeah, we'll be back next week to discuss all of that. All right, everyone, take care and have a good day.